Hello everyone, and welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. My name is Ann Potempa, and I will be facilitating the talk today. Our section's vision is for healthy and safe Alaskans, and our mission is to identify and advance the conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease prevention, and data collection and surveillance. The webinar series was created to provide a forum where we as public health professionals can talk about specific projects and explore ways we can work together. We will be offering webinars on the third Tuesday of every other month at 1 p.m. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects and explore opportunities to work together. Another way you can stay connected to our work is through our newsletter. You can sign up for the newsletter on our section's website. Our website address is at the bottom of our slides. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Also, please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of Q&A. The audio for this webinar should be coming through your computer or through the telephone number that was provided for you. If you have technical difficulties during the webinar, please let us know by using the question panel in your sidebar. You should have a section that looks like this on your sidebar. You will need a microphone on your computer, or you'll need to use the telephone number provided to ask a question out loud. All questions, except for those about technical difficulties, should be held until the end, and then we will have more time to discuss them. To join the conversation or to ask a question, please raise your hand. We've got a picture up on the slide to show how to do this. On the sidebar, you should have a yellow hand that you can press on. When that's raised, we'll start answering questions in the order they're asked. And with that, I am now going to pass this over to Dawnell Smith, who will be giving our presentation today.
Hi, thank you for joining us. My name is Dawnell Smith, and I work in the Public Information Office with the Department of Health and Social Services. I've been involved with Alaska's public education campaign on marijuana since the summer of 2015. I think it will help to provide some context for our campaign. So we're looking here at some information about youth use of marijuana in Alaska. Recreational use of marijuana is now legal for adults 21 and older, but it's still illegal for those under 21. We know Alaska teens are using marijuana, however. Every other year, teenagers from dozens of selected high schools across the state complete the Alaska Youth Risk Behavior Survey. In 2015, more than 2,000 Alaska students participated. The survey's results show that about 1 out of 5 Alaska teenagers currently uses marijuana, which is more than those reporting smoking cigarettes in Alaska, which is about 11%. An even larger percentage of teens said that they have used marijuana at some point in their life, about 39%. That percentage has decreased since 2007, however, and that decrease is statistically significant. About 1 out of 4 Alaska teenagers says there's a chance they'd be seen as cool if they smoked marijuana, and about 3 out of 4 say they believe their parents would think it was wrong if they smoked marijuana. We also know that among Alaska high school students, marijuana use tends to be higher among Alaska Native teenagers than white teenagers. This difference is not statistically significant in all survey years, however. It's interesting to note that current marijuana use is lower among adults than teens in Alaska. As you see in this chart, about 12% of Alaska adults reported using marijuana at least one time during the past month. As noted 2 slides ago, 19% of teens reported use during the same period. Adult use varies by age group. The 18 to 25-year-olds are more likely to use marijuana than adults over 26. About 20% of adults reported using marijuana during the past year. And there's a low perception of great risk associated with smoking marijuana at least once a month. This data come from the National Survey on Drug Use and Health, an ongoing survey completed in all 50 states. Marijuana-related questions were added to the 2015 and 2016 Alaska Behavioral Risk Factor Surveillance System as well. 2015 data is being prepared for analysis now. When looking at public health issues, we often focus on vulnerable groups. One concern is with marijuana use during pregnancy and breastfeeding, in particular in terms of its exposure to the baby and the possible interference with brain development. In 2013, about 6% of Alaska women reported smoking marijuana during pregnancy. 7% reported smoking since their baby was born, and 14% reported smoking marijuana in the 12 months before getting pregnant. The prevalence of marijuana use before, during, and after pregnancy was higher among Alaska Native mothers than white mothers or mothers of other races. With that background in mind, let's look at the marijuana education campaign. Alaskans voted to make recreational use of marijuana legal for adults in November 2014. We had to move quickly to clarify the law. But it's important to build messages based on facts. Back in the 30s, private interest groups made the propaganda film Tell Your Children, now more commonly known as Reefer Madness, as a morality tale directed at parents. In the 70s, marijuana advocacy groups rediscovered the film and screened it at college campuses across the country as satire. Now, as then, people talk about Reefer Madness as the kind of melodramatic, overwrought messaging they distrust. We knew, too, from research by the Centers of Disease Control and Prevention that many people distrust government and its messaging. Reefer Madness was not made by a government agency, yet people still allude to it as the kind of government bias and misrepresentation they distrust. Part of our job, then, is to stay factual in content and tone and rebuild trust so that Alaskans get the health information they need. With that in mind, we set some campaign goals, such as driving people to the health information on our website and building trust through humor, visuals, and messages so that Alaskans look to us for the most recent and accurate health facts on marijuana. The first PSA we did in 2015, you can find it on the YouTube page for Alaska Department of Health and Social Services, focuses on legal issues and keeping marijuana away from kids. We're going to play that now.
Now that marijuana is legal in Alaska, there are a few things we all need to know. It can't be bought or sold yet, and if you're under 21, forget about it. You can't use marijuana in public places, state parks, or on federal land. It's best kept at home, away from the kids. Marijuana is not healthy for their growing brains. You can't drive high. Driving high is a DUI. And what's grown in Alaska stays in Alaska. Get the facts at marijuana.dhss.alaska.gov.
Now, this PSA kind of supported our website. Colorado already had a great site with recent research and data that had already gone through a rigorous scientific literature review. We started with that information, then revised and expanded with our own materials. That collaboration made it possible for us to build the site quickly. We augmented this with outreach materials to clarify the law and use of public spaces, for example, and directed towards visitors, because though marijuana use and possession was legal for adults in 2015, it could not be bought or sold yet or taken out of state. We also created some supporting materials, like a written overview of the points made in the PSA and a fact sheet to emphasize that driving high was illegal and unsafe. And also to address some public health concerns, like marijuana use during pregnancy and breastfeeding, or use by youth and the potential health impacts it could have on youth brain development. The campaign results, May and June 2015. We did several months of TV and radio play and several months of Facebook ads. It's important to note a few things about social media. We did newsfeed ads and boosted posts. Newsfeed ads don't have what's called organic reach, which means they are not posts you share directly from your page and that show up in the newsfeed of fans or friends based on the Facebook algorithm. They're paid ads with targeted audiences. Our audience is Alaska adults. We also did boosted posts, which are slightly different. With them, you do a post on your page, often gaining some organic reach, meaning people who already like the page and possibly their friends see it naturally in the course of using Facebook. And then you pay to extend the audience that sees it, so you boost its visibility. In social media, we also talk about separate kinds of metrics or ways that you evaluate your campaign. The word reach tells you how many different people saw your content. Impressions tells you how many times your content got displayed. Engagement tells you the number of interactions people have had with your content, such as likes, comments, shares, retweets, etc. Clicks can tell you how many times something in your content was clicked, such as a link, name, video play, and so forth. Our campaign did well on all accounts, notably in terms of impressions, with over 360,000, and different people reached nearly 240,000. For the 2016 campaign, we moved away from legal issues and focused more on public health concerns. Here we wanted to focus on things we knew Alaskans would need to know, like the delay that can happen in feeling high when using marijuana edibles and the potential for overuse or accidental use. And we wanted to touch on the potential harm of use on particular groups, such as youth and pregnant women. We also used data from other states to help inform our messaging. Marijuana-related ER visits and hospitalizations increased in some of those states. But we also wanted the same look and feel as the 2015 PSA, but working with a tinier budget, which means we had to use cable to go statewide and selected broadcast ads on KTUU and KTVA, along with Facebook and YouTube. We're going to play the PSA now.
Marijuana is now legal in Alaska. Here's what you need to know. The legal age for use is 21. Marijuana can affect people differently based on body type and history of use. It can take a while for the full effects to kick in, especially with food and drinks made with marijuana. These aren't your grandma's brownies. Today's THC levels can be a lot higher. Steer clear if you're pregnant or breastfeeding. Careful with cannabis edibles. They look like treats but will make little ones sick. Learn more at marijuana.dhss.alaska.gov.
The campaign ran between May 1st and June 30th, 2016. The PSAs aired 229 times. Our YouTube ads overperformed, and we got quite a few impressions, clicks, and reached quite a few people with that campaign. But we also felt the social media battleground. As with all messaging, we've got a lot of work to do. We got a range of comments about the PSA. Some people said it was balanced and they liked it. Others likened it to reefer madness. It's important to keep in mind that with legalizations comes marketing. The messaging people see will vary, and much of it will be about selling marijuana products. In April 2016, The Atlantic published an article called The Art of Marketing Marijuana, in which people in the industry talked about marketing. Marijuana is becoming a commodity, they said. Growers and manufacturers will compete for customers through their brands, just like what happened with alcohol and cigarettes. As marijuana goes from counterculture to business culture, there will be marijuana ads that sell it as healthy, or lifestyle ads that sell it as cool and family-friendly. The industry will want to build loyal customers while vying for new ones. The article in The Atlantic even mentions how people in the marijuana industry prefer using the word cannabis because it sounds more pleasing to mainstream audiences. As the marijuana economy grows, different communities and regions will establish their stake in the industry. Alaska was one of the first states to legalize it and will be one of the first states to experience both the expected and unexpected outcomes. Our education campaign will need to adapt in order to put out messages based on facts and with a focus on public health. Ongoing science and surveillance will determine the public health message, and the public health message will in turn determine the trust Alaskans have in the information we share. As we keep to the goal of the Alaska Marijuana Education Campaign to protect and promote the health of Alaskans. I'd like to quickly give kudos to the development team for this education campaign, particularly the public information staff that created and promoted all the materials which were produced in-house, and also open up to questions.
So Dawnell, there's one question in here about the phrase used in the PSA. It says driving high is a DUI. Is that a copyrighted phrase, or can a local fire department create materials with that line?
That is not copyrighted.
Not that I understand either. That was a line we created for the PSA, but it can be used by other people.
Yeah.
And yes, Emily, even if you don't have a mic, you are definitely able to write your questions in, so we'll wait for that one to come forward. While Emily's doing that, does anybody else have any questions? Either you can say them over the phone line or type them in. Here's the question. Which state agency might allocate research money for marijuana research? What is the source of current cited research? Also, is there evidence edibles are less harmful? So let's take these one at a time. Which state agency might allocate research funds for marijuana research? At this point, we have been using Division of Public Health funds and Mental Health Trust Authority funds when they are available to do all of the work related to the marijuana public health education campaign. The source of current cited research, as Dawnell mentioned at the beginning, we used a lot of the literature review that Colorado did. We had the advantage that a number of other states had gone before us to legalize marijuana, and so they have a significant literature review that we include on our website, and that is primarily what we used. And then our Chief Medical Officer and Division of Public Health staff looked through all our materials prior to them going public. We have a lot of questions coming in here, so hold on as I try to field them.
Questions about edibles.
Is there evidence edibles are less harmful? Emily, I think that's a question we're going to have to look into and get back to you on, but thank you for sharing that question. Do you have examples of flyers or posters we can use?
I think we do have a couple of materials on the website, and I can get back to you with direct links to those materials.
So thank you, Christopher. We'll get you those links, and all of those materials are available on our website. In some of them we have in printed form. Is that correct?
I think we have some, yeah.
Mm-hmm. This question comes from Janice. What specific facts did the Facebook user think were not facts stated in the PSA?
It's interesting in the comments, and keep in mind that social media comment universes, people sometimes are commenting on other comments, and they will take that energy or whatever they see in a comment and apply it to what they see rather than looking at the PSA objectively. That's one thing that happens. I know that one of the things that came up repeatedly was the question about marijuana use during pregnancy, and quite a few people were suggesting that they thought that it could be healthy during pregnancy, specifically if women had certain conditions, and that came up repeatedly. That was one issue that came up. If you look at the PSA, it really just says steer clear. It's giving very, very general information. It wasn't terribly specific. So those were the kinds of conversations that happened. I'm trying to think if there was another fact that specifically came up aside from use. I think one commenter talked about it as being almost like a rite of passage. Like it was silly to say it's illegal for under 21 because all teenagers want to smoke marijuana is kind of what the context of the comment was. And again, that's just coming from a particular person's perspective and the way they're looking at things. It's not based on any kind of facts that they we're able to present in the comment section.
Thank you, Janice. Question from Wendy. How can we get the printed resources such as the brochure for parents?
It's interesting. We just had a meeting this morning. We're going to get the parents' guide up by the end of the month. It's finishing its final vetting process, and that is a pretty substantial guide, and we'll also have a smaller kind of rack card type of thing available then. So I would say by the end of August is what we're shooting for, to have that online on the marijuana page.
Dawnell, just to clarify, those will be online resources, so if you wanted them printed, you'd have to print them yourself?
It'll be definitely online, and we are also going to print some. If you have a specific need or desire for them, let me know, and I can give that information to Jenny Baker, who is handling that.
Are there plans to develop a PR campaign specifically targeted to tweens or teens to resist use and abuse? This question comes from Noelle. Noelle, it's a little too soon for us to know the answer to that. I will say there are a number of states that have already started pursuing that with a significant amount of research done before and after the fact, and they're just releasing those campaigns right now. Oregon has one as one example. You can go online and find that. We are really new to this. We're going into our second year, and we're now sort of exploring the vulnerable populations that we need to be concerned about as to which direction we're going to take our campaign in. Emily has another question. Is there AK Public Health interest in the medical benefits of CBD, anxiety, cancer, epilepsy? Emily, at this time, the folks in the room don't have an answer to that, but we can look into it and get back to you on that. Did you try to partner with the Alaska Broadcasters Association?
We partnered with them before, and that may be something we do in the future, but we were unable to this time.
How are DUIs for marijuana measured?
Yeah, that is, as far as I know, a very difficult thing that law enforcement is tackling. Right now, my understanding, does anyone correct? My understanding that it's primarily based on just like a DUI with alcohol, but without the breathalyzer. You're looking at behavior and testing of performance type of things.
Yeah, that would probably be a better question addressed for public safety. But yeah, it's a good question. And that's all the questions coming through right now. You can stay on the line for a little bit longer if there's any more questions.
I had a question. This is, I guess, really broad-based and maybe self-evident, but why is Alaska's Public Health Department even looking at marijuana?
Public health was part of a work group that included behavioral health, public assistance, and other department staff to focus on possible outcomes and address at-risk groups such as youth and pregnant women. There are quite a few agencies involved as legalization was in process.
Thank you.
Here's a question from Kimberly, but Kimberly, I'm going to need you to clarify something here. It says, I'm also wondering how it was measured. Would you share that information should you come across it? Can you clarify what you mean about what was measured? Oh, regarding the DUI and also if the charges were the same for alcohol. Again, Kimberly, this is an area that's best addressed by public safety. This is actually an interesting area for this campaign because when this became legal, we felt the need to get a lot of information out right away. And so some of our earlier PSAs, as Dawnell was showing them, did touch on some legal issues. And now we're moving more in the area of public health issues. But really, public safety is going to be your best place to take this question.
Yeah, we definitely have an interest in terms of injury prevention, but in terms of how DUI is assessed and what the charges are, yeah, that's definitely the public safety.
Any other questions? How were the pregnant women measured, or was that a survey of sorts? I'm going to send that question over to Ray, who works with our...
Yeah, I think it's from PRAMS. It's
okay.
PRAMS data.
maybe, is it pregnancy?
Risk assessment monitoring system.
Yeah.
So if you didn't hear that, was pregnancy risk assessment monitoring systems. It's a survey that's done with pregnant women and also after they are delivering their babies. Does public safety have its own website on this issue? That is a good question. Public safety did put out a PSA last year that we had linked to about being safe and driving safely related to marijuana. But you'd have to look on their website at this point. I know that the Marijuana Control Board in that area has their website that's more focused on regulations and licensure, but you'd have to check the public safety website for that.
Regarding that earlier question about the safety of edibles, I think one generality that we can say is that we know you're not posing as much risk because you're not inhaling it, but then there's a whole other issue with dosing that we're unsure about. So that might be what we can say.
Mm-hmm. Any other questions? A couple minutes left if anybody has any other questions for us. All right, well, thank you very much for listening today. We will be saving this and posting it on our website, the PDF of the presentation as well as the webinar. And as soon as that's up, we'll send an email to everybody so they can find it to review it again if they'd like. Thank you very much for attending. Thank you, Dawnell.
Thank you.